Let's talk about herpes prevention. The way to prevent HSV is, right after birth, to wrap an uninfected child in a blanket, place them in a basket, and leave them in a cave where they will never have any human contact ever. Done. No herpes. How does that sound? Now, for something more practical, in terms of primary prevention, there's not much. There are no HSV vaccines yet. Fingers crossed. For HSV1, most people get it in childhood. It's best not to kiss anyone or be kissed by anyone with an active cold sore or HSV lesion, although it's hard to prevent. Now, as far as transmission of herpes from genital to genital or oral to genital or genital to oral, essentially to prevent transmission, someone who has oral lesions should not perform oral sex. And if someone has genital lesions, they should not receive oral sex. But remember that HSV1 and HSV2 can infect either site. And the same goes for all other kinds of human sex, genital to genital, anal, oral anal, etc. So basically, if the lights are on and there are lesions, there's a clear known risk of transmission. And if the applicable intrepid parties are nonetheless going to participate in these activities, barrier methods including condoms can help reduce the risk of transmission, but only by about 50%, and not much more than that. The wrench in this whole thing, besides human nature, which we won't go into, is that people can have herpes and not know it, and shed it and not know it. And even if they've had herpes and know it, they can still shed it when they're asymptomatic. So basically, herpes will continue to be a successful human viral infection. Luckily, there is a treatment, which we'll get to later. But the most important kind of prevention would be to a herpes-free pregnant woman. If her partner has known herpes or frequent outbreaks, they can practice abstinence, use barrier methods, and the partner can take anti-herpes medication like valacyclovir to reduce the risk of transmission. And of course, this is all to prevent neonatal herpes, which is one of the most severe consequences of herpes infection. Now, if the pregnant woman has genital lesions when she goes into labor, whether or not it's a new infection or reactivation, we try to prevent transmission to the neonate by giving mom a C-section. And lastly, as far as preventing herpes recurrences, some people get oral outbreaks from sun exposure, so sunscreen can be recommended. And if there are frequent genital outbreaks, suppressive therapy can be tried. And lastly, if someone feels like an outbreak is about to come on, he or she can start therapy right away, and that can mitigate the recurrence.